My name is Dr Melanie McDowall and I'm a researcher in the Robinson Institute within the University of Adelaide, and my research interest is oocytes and early embryo development, so that covers the period of leading up to ovulation, fertilisation and then before the embryo implants into the uterus. So an oocyte is an egg, but in embryology world we call that an oocyte. Peak fertility in females is in the late teens through to the mid-20s, and then by the time a woman is in her early 30s, fertility starts to decline. However, there's a rapid decline by the time she reaches her late 30s, and by the time she reaches her 40s, fertility is about half of what it is during her peak fertile period. Ovary and oocyte development begins pretty much about 2-3 months after conception, and by the time a girl is born, she's born with about 1 million oocytes. By the time she reaches puberty, that oocyte pool goes down to about 300 to 400,000, and then it continually declines until she reaches menopause. So there's a finite number of oocytes available to undergo successful development and growth. In ageing mothers, you tend to have an increased frequency of something called Aneuploidy, where you have the wrong number of chromosomes. So you either have too many or too little. So a really good example of that is Down syndrome, which is an extra chromosome 21. In most cases, if you have missing chromosomes or too many chromosomes, this results in miscarriage or stillbirths. There is definitely such thing as an expiry date on human eggs or oocytes. I'm quite aware of the recent amount of publicity that has been put into the idea that women's fertility might not decrease as much in her 30s. But there is a lot of evidence from both research labs as well as clinical labs that demonstrates that there is definitely a relationship between advanced age from 30 onwards and a decline in fertility. A common test now that's been in practice for the last decade is the anti-Mullerian hormone test, or the AMH test, and this is also referred to as the egg timer. So the AMH is produced by the ovary or the ovarian cells, and the concentration of AMH in blood is very highly related to the number of oocytes within an ovary. So AMH levels are quite consistent until a woman is in her mid-20s and starts to decline until it's undetectable when she reaches menopause. There's also a lot of data coming out of clinical IVF labs that show that a woman in her 30s using her own oocytes to undergo IVF, when an embryo is transferred, she has between 20 and 30% chance of having a live birth. However, once she reaches her 40s, that declines to about 10%, and then when she's 45, that's about 2%. If these women use donor oocytes or donor embryos, the rate of live births remains constant. So it pretty much demonstrates that it's the oocyte component that's having a major effect on fertility and ageing. So there's a lot in the media about women who are in their 40s and even 50s that are considering getting pregnant. However, that's highly unlikely, and that's if they are using their own oocytes or are getting pregnant naturally, that's the exception rather than the rule. And also, we have no idea what happens behind closed doors in celebrity world. We don't know whether these people are undergoing IVF using donor oocytes or embryos. In most cases, I would say that's what's actually happening, is that they are using donor. In the reproductive world, we like to remind everybody that it takes two to tango. So the fertility of a couple is dependent on both the female and the male. So even though a woman might be in her peak fertile period, the age of her partner as well as his health also is a contributing factor to the success of them having a successful pregnancy.